Have you ever felt unsure about the anatomy in that area? If you are having intercourse or being intimate with someone who has a vulva, or if you have one yourself, let me introduce myself. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to cover everything you should understand about female anatomy. Be sure to watch until the end of this video, because I'll explain what the well-known G-spot actually is and what you really need to understand about it. If this is your first time here, I'm a board-certified urologist creating educational urology content focused on sexual health, bladder wellness, and much more. So please subscribe and share this video with people you care about. When we talk about detailed anatomy, it's helpful to first understand how the body develops. To keep things simple for this video, I will refer to anyone with a penis as male and anyone with a vulva as female. When a fetus is forming inside the uterus, meaning during pregnancy while the baby is developing, in the first 8 weeks, there are no visible genitals. The fetus has two basic structures that will later grow into either female or male anatomy, and these are called the genital tubercle and the urogenital sinus. At around 10 weeks, the fetus begins forming either male or female external genitals, based on the baby's genes. If the chromosomes are XX, the baby will develop female anatomy, and if they are XY, the baby will develop male anatomy. The genital tubercle, as shown here, grows into the head of the penis in males and the tip of the clitoris in females. Because these body parts grow from the same original urogenital sinus and genital tubercle, which were identical in both fetuses early on, they are known as homologous structures. This means they come from the same embryonic tissue and end up having very similar functions, structure, and position in the body. So in both men and women, the head of the penis and the clitoris form from the same starting tissue, and the clitoral hood and the foreskin of the penis also come from matching tissues. Then, if you look at the labia lips, meaning the outer and inner lips of the vagina, the scrotum in males is actually comparable or similar to the outer vaginal lips, which are called the labia majora. So everything shown in this image is known as the vulva. At the very top, you can see the clitoris, which, as I mentioned earlier, is comparable to the male penis, specifically the head of the penis. It contains a very high number of nerve endings, and in many cases, stimulation of the clitoris leads to orgasm in women, similar to how men usually require penile stimulation to reach orgasm. The clitoris also has a covering called a hood, which is known as the prepuce. The prepuce can cover the clitoris and can move back and forth, much like the foreskin on the penis. Interestingly, in some cases, the clitoral hood can develop adhesions, meaning it can stick to the top of the clitoris, and for some individuals, this may cause discomfort or pain. Before we move on to other parts of the anatomy, let's take a closer look at the clitoris. Interestingly, the word clitoris comes from the Greek word klitoris or kleis, which means key or something that opens a door. That's quite fascinating. From an embryological point of view, the clitoris is essentially identical to the penis, including what would be considered the head and shaft of the penis. And even though it appears quite small, and you can only see a small portion of the clitoris from the outside, when you look at the full internal structure of the clitoris, and you can see an illustration of it here, it is actually quite long and splits into two parts, very similar to how the erectile tissue of the penis is structured. In fact, when researchers have performed detailed anatomical studies and dissections, they found that the nerve supply and blood vessel patterns are very similar to those of the penis. Like the penis, the clitoris can also swell and fill with blood during arousal, leading to enlargement and firmness, which is very similar to what happens during a male erection. I explain this process more in my video discussing sildenafil and tadalafil, if you'd like to understand more about what occurs during an erection in men. You can also see here that this erectile tissue surrounds the urethral opening and the vaginal opening and extends outward toward the sides. Because of this, it sits just beneath parts of the inner vaginal lips, also known as the labia minora, which is why some people find those areas especially sensitive. Just below the clitoris, you will see the urethral opening. The urethral opening is basically the end of the tube that carries urine out of your body. Your bladder produces urine, and it leaves the body through this urinary tube. Just below that, you can see the vagina itself. The vagina is a remarkable structure because it can change its shape. As many people know, during childbirth, it can stretch significantly to allow a baby to pass through. In a similar way, during arousal, it becomes wider and can lengthen by as much as 3 inches when a person is aroused. And finally, below all of that, you can see the opening to the anus. In women, we often describe there being 3 openings: the urethra at the very top, then the vagina, and lastly, the anus. As I've mentioned throughout this video, the clitoris is comparable to the penis, so many women require clitoral stimulation to reach orgasm. However, many people also talk about something called the G-spot. So what exactly is the G-spot? It was first described in 1940 by Ernst Grafenberg. It is located along the upper part of the vagina, also called the anterior vaginal wall, usually about 1 to 2 inches inside the vagina. Many people describe locating this area by inserting a finger into the vagina and making a "come here" type of motion. However, it's not like a special button that you can simply locate and press. Instead, it's an area that contains a very high concentration of nerve endings. Interestingly, just above the vagina in this region is something called the Skene's gland. The Skene's gland is comparable, or homologous, to the male prostate. I've talked before about prostate massage and how some people experience pleasure from it. And in a similar way, some women may also find stimulation of this area pleasurable. But is this G-spot the ultimate key to pleasure? For some women, stimulation of the G-spot during penetration can lead to orgasm. However, for most women, clitoral stimulation is still needed for orgasm to occur. Because, as I've explained throughout this video, the clitoris has similar sensitivity and tissue structure to the male penis. Because of that, many women commonly need clitoral stimulation to reach orgasm. I hope you all found this introduction to female anatomy helpful. And as always, remember to take good care of yourself because you deserve it.